Hello, my name is Dr. Dewan S. Raja. Today I will discuss about pericarditis. Pericarditis is the inflammation of the pericardium, and pericardium is a fibroserous sac surrounding the heart. So this is pericardium. We have fibrous pericardium, parietal layer of serous pericardium, visceral layer of serous pericardium. Okay, what are the causes of pericarditis? It may be idiopathic, we don't know the exact cause. It may be due to infection, viral infection, bacterial infection, or fungal infection. It may be due to post-cardiac injury syndrome, cardiac surgery, pacemaker insertion, and other cardiac intervention. Cancer and cancer therapy, some medication may cause pericarditis, some chemotherapeutic drug. The cancer surrounding cancer in the mediastinum can spread to the pericardium. Other diseases, autoimmune disease like hypothyroidism is associated with pericarditis, and we have immune immunological cause may cause maybe the reason for pericarditis. Okay. So there are many causes of pericarditis. It may be idiopathic, maybe post-cardiac injury, maybe due to infection. Infection may be bacterial, viral, fungal. Due to other diseases like autoimmune disease like hypothyroidism, cancer can spread to the pericardium as a metastasis, or there may be pericarditis as an adverse effect of some chemotherapeutic drugs. So, what are the symptoms and signs of pericarditis? Pericarditis, inflammation of the pericardium, a thin sac surrounding the heart. Thin means here, actually, this is not thick. Thin means it is the parietal layer of serous pericardium and visceral layer of serous pericardium. These are thin, but the outer layer, the fibrous pericardium, is thick. So, inflammation of the pericardium, there is a sac around the heart. Symptoms and signs include chest pain, sharp stabbing pain that may radiate to the shoulder, neck, or back. It often worsens with deep breathing, coughing, or lying flat. Improves when sitting up or leaning forward. Remember that this pain improves when a person sitting up or leaning forward. That will decrease the pain in that situation. Parietal pericardium, serous layer, and the visceral pericardium of the serous pericardium, visceral layer, and parietal layer will not go through friction. If a person lean forward and sitting up, there is less chance of friction between the parietal layer of serous pericardium and visceral layer of serous pericardium. Fever, low-grade fever may be present, especially if caused by an infection. Shortness of breath can occur, especially when lying down. Fatigue and weakness due to inflammation and possible reduced heart function. Palpitations, sensation of a rapid or irregular heartbeat. Signs of pericarditis, what we get by physical examination. Pericardial friction rub, very important, a scratchy or grating sound heard with a stethoscope caused by friction between the inflamed pericardial layers. Tachycardia, fast heart rate due to inflammation or pain, pulsus paradoxus. In severe cases, drop in blood pressure during inspiration. Signs of cardiac tamponade, if severe, there will be hypotension, muffled heart sounds, and distended neck vein. We call it Beck's triad. So hypotension, muffled heart sound, and distended neck vein, that is Beck's triad. This is sign of cardiac tamponade. In severe case of pericarditis, there may be complication. There may be acute accumulation of fluid or blood inside the pericardial cavity. So there will be compression to the heart by the fluid, particularly it may be blood, and it may compress the right atrium that may lead to the hypotension, muffled heart sound, and distended neck vein. We call it Beck's triad. Diagnosis: pericarditis is an inflammation of the pericardium, the sac surrounding the heart. Diagnosis based on clinical evaluation, imaging, and laboratory tests. What clinical criteria for diagnosis? At least two of the following four criteria are needed for diagnosis: chest pain, sharp pleuritic, and worsen when lying down, improves when sitting up and leaning forward, pericardial friction rub, scratching or getting sound heart with a stethoscope. Okay, ECG changes, widespread ST segment elevation, and TR depression. In early stages, we may develop, our patient may develop pericardial effusion, collection of fluid in the pericardial sac that is detected by echocardiography. So, at least two of the following four criteria like chest pain, pericardial friction rub, ECG changes, and pericardial effusion. Out of these, at least two we need for clinical diagnosis. We have some diagnostic tests for diagnosis like electrocardiogram. It is important to remember diffuse ST segment elevation, PR segment depression, echocardiography evaluate pericardial effusion and cardiac function, chest X-ray may show enlarged cardiac silhouette in case of significant pericardial effusion. Cardiac MRI CT helps assess pericardial thickening and inflammation if needed. Laboratory test, inflammatory marker, elevated C-reactive protein, CRP, and ESR, that is erythrocyte sedimentation rate. Cardiac enzyme like troponin may be elevated if there is myocarditis involvement. So we know that the visceral layer of serous pericardium, that is epicardium, is just over the myocardium, the muscle layer. If the muscle is involved in the inflammation, muscle of the heart wall is involved in the pericardial inflammation, then we will get troponin level high. Blood culture and viral serologies if infection is suspected. So differential diagnosis, myocardial infarction, but usually this is more severe pain, pulmonary embolism. Okay, so that is a possibility also. Then we have to do some other tests to diagnose the pulmonary embolism, ventilation perfusion ratio to find out that, and we do thorough CT scan, MRI, aortic dissection. The aorta, there may be another channel inside the wall of the aorta, and that may rupture sometime. Pneumonia, that pain is usually severe, very severe pain. Pneumonia, there's history of respiratory tract infection, gastroesophageal reflux disease. These all are differential diagnosis of pericarditis. Okay, suppose myocardial infarction in a diabetic patient, it may not be very painful. Red flag suggestive of complication like cardiac tamponade. There will be hypotension, distended neck vein, muffled heart sound. These three we call Beck's triad. Pulsus paradoxus is another sign. Drop in blood pressure greater than 10 millimeter of mercury during inspiration. That is also a red flag, like complication like cardiac tamponade. Treatment of pericarditis depending on the cause, like viral idiopathic cause, that will give the NSAID, non-steroid anti-inflammatory drug plus colchicine to decrease the pain and inflammation. Bacterial, it may be tuberculosis, purulent pericarditis, intravenous antibiotic plus pericardial drainage. In case of tuberculosis, it is a 9-month therapy with multi-drug like rifampicin, INH, the ethambutol, okay, or pyrazinamide. Then we'll continue with that of the rifampin and the pyrazinamide, and we'll withdraw the ethambutol. Okay, and certainly we'll continue with the INH. So tuberculosis will follow the treatment procedure. Usually it is 9-month therapy. Okay. Ischemic pericarditis, the management is by dialysis. Autoimmune condition like systemic lupus erythematosus, rheumatoid arthritis, if this is the cause, then management by steroids like prednisolone and other immunosuppressant. Okay. So post-myocardial infarction, Dressler syndrome, management by aspirin and colchicine will avoid NSAID early after MI. And treatment followed by management of complications. Like if there is pericardial effusion, then we go through pericardiocentesis. If it is a cardiac tamponade, we must go through pericardiocentesis. We may continue, we must watch for future if there is any type of collection of fluid. So continuous surveillance is also important. And that's all about the pericarditis. If you have any question, please feel free to ask me. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.